I'm a strange being called, that wears the label of clinical ethicist. There aren't many of us. Practicing clinical ethicists number fewer than 100 in Canada. But I think the rise of the young field is certainly related to the advancement of technology in medicine, which has created these questions of what should we do? You know, starting with how should we use technology? So we had some incredible technologies developed in the middle of last century with things like respirators that can help you breathe, dialysis machines that can replace your kidneys. And as we began to use these, we realized that new questions were generated, such as, is it okay to ever take away the ventilator or to not use it for somebody who might benefit? You know, what about a dialysis machine? You know, once you start using that to replace your kidneys, can you just say, no, I don't want to do this anymore? So that was a bit of a struggle. And then as the last century progressed, we also learned a lot about science and technology and the way that research is conducted, with some just egregious examples of terribly disrespectful research. So I mean, the classic examples of what? When I say 20th century, really egregious examples of bad ethics in research, what comes to mind?
A study in the States where they gave a big population of African American syphilis.
Yeah. So the Tuskegee syphilis study, they actually already had syphilis, but the scandal there was that this study that started in the mid-1930s, about 1,000 American black men, the goal was to learn the natural history of syphilis. So syphilis is a lifelong disease. It helps to learn what happens after years and after decades. But the shocking thing is about 10 years into the study, the antibiotics which would treat the disease, you know, a cure, were withheld. And they were withheld deliberately for the sake of the greater good, that we need to learn more about the natural history of syphilis, so we're not going to treat these guys. And you know, obviously, when you think about that, it's an example of misplaced priorities, where you're, you know, completely disrespecting certain individuals, let alone not informing them. So other examples of some pretty bad stuff that went on in medical ethics last century?
I just had this physiology class in the morning, and we were learning about these muscle and tendon studies, where they did a lot of like invasive procedures to gain knowledge about the topic on people that were sentenced to death.
Yeah, so another big thing, the idea that prisoners are available to be experimented on is also one that when you stop to think about it, is not a very good idea. Completely disrespectful and lacking that thing that we love so much in ethics, which is the idea of consent, of asking patients or research subjects, is it okay what we propose to do to you that we proceed? So one of the things that emerged in the last century in terms of the ethics of medicine and technology was this idea of consent. So another, big famous case out there are the Nazi doctors. You know, when Nazi Germany came to power, lots of things happened, but one of the things was that physicians who were willing to, do these really cruel experiments that were largely aimed to defend or prove the Nazi ideology, just became a shock to the whole world when they were revealed that physicians could put their subjects, patients, through these things where the end of the experiment was intended to be with the death of the patient. And the fact that that could happen in the supposedly modern world was shocking to everybody. So the rise of the field was largely a response to some of the things that went on. So I'm one of the people that took a chance at pursuing this type of career called ethicist. So I spent 15 years at the Royal Alec Hospital, where the main goal is to offer a service that helps people facing really tough ethical questions. Should I do this or should I do that? Or, I'm bearing witness to something that's making me very uncomfortable. And then the goal was to try to help them think that through, or to deal with it, or to make a good decision. So that's where I come to this from. So right now I'm at the John Dossler Health Ethics Center, which is an ethics center affiliated with the medical school. So Dr. Solis has asked me to do a series of lectures. So the real goal here is to prepare you guys, first of all today, with just some of the fundamentals of, so how do we think ethically anyway? And what are some of the issues that we ought to think about in the future of medicine and the future of artificial intelligence and that type of high technology. So as I'm going through these slides, and you can get a copy of them, feel free to stop me at any time and ask questions. So first of all, let's define ethics. What do we mean when we talk about ethics? You will no doubt have heard the word ethics and morality used interchangeably. What is that moral point of view? What is that ethical point of view? I think it's legitimate to use them differently, but I think of ethics as the study of morality. So ethics is an academic discipline, something we do in the university when we think about what is right and wrong, what is good and bad, how do we know, and so I think it's useful to make that distinction. We're looking at what do people think. And so there's a couple important ways to look at that. So descriptive ethics answers that question. What do people think about right and wrong, good or bad? How do they tend to make decisions? Why do they do that? How much does their background affect what they think? So the question of what's happening currently is what we call descriptive ethics. Can we explain why the Nazi doctors did what they did? Why did the people running the Tuskegee syphilis study think it was okay? And in some ways, it's another example of we have our current sensibilities of what's right and wrong in how to treat people. We often have a tendency to think that people 50 or 100 years ago ought to have felt the same way. And so part of descriptive ethics is understanding how the times affect what people think about right and wrong, good and bad. And you can see how those things evolve. So normative ethics is the type of ethics that asks the question, what should we do? So the normative question has that word should or ought, and it in some ways is the more interesting part of ethics. All things considered, what should we do with new technology? What should we do with current technology? How should we treat people? Those sorts of things. And so you need to do both. In order to really do a good job on what should we do, you need to first think about, well, what are we doing? And how are things done currently? So a lot of what I'll describe today is aimed to lay the foundation for some of the more specific questions we'll look at in the course later. And so what are some of those future ethical issues? So I've got a partial list here. As I'm going through it, see if you can think of any more to add at the end. So one is, high-tech diagnostics. You've heard of the X Prize. So one of the things out there to encourage innovation has been somebody offers a big sum of money for teams of researchers to pursue a goal. So one of them I think had to do with rockets. Somebody build a type of rocket that could go out and come back and we'll give you $10 million or $100 million, and it provides incentive. So there's a similar type of thing for people who want to encourage us looking at all the technology that we have, and can we do a really good job of diagnosing what's wrong with people, basically seeing inside your body so we can tell what's wrong with you. So we've got all sorts of what might be called primitive ways of doing that, things like X-rays that go through your body and create an image. Prior to that, we would if we couldn't see directly, you'd try and listen to what was going on in the body. And yet still, even though we're not that big, it isn't that simple a task to just penetrate the body and get a clear image of everything. But if we could, it would create that ability to diagnose exactly what's going on with people. And then it becomes a technological problem. So Dr. Solis is a pathologist, so a lot of his work would be looking at samples of what's going on inside people's body. But I'm sure he would love that idea of the advanced technological thing that we would just put it in front of you. It could detect everything without us having to go in and take a sample of it, which is what we currently have to do. So the way that such high technology will help doctors, and how should it be used, and is it something that you can get in a home kit, or does it have to be wielded by professionals? Those will be some of the questions that we have about things like that. So privacy in the computer age. We know that confidentiality is an important thing in medicine, that what's happening to you physically is something that's intended to be shared between you, the doctors or nurses that might be taking care of you. So we know that privacy is an issue, and it's one of the things we worry about as we move more and more into computers and advanced technology being involved. Are those things really safe? So do any of you share the sense that I've had just in recent weeks that I don't think that we're ever going to have information online that we can say is totally safe? Do you agree with that? I mean, it's hard for me to imagine that somebody's going to be able to build something that's truly online, that isn't totally walled off from the system, that we're going to be able to say this is totally safe, no one can penetrate it. And it raises questions about medical records. So are all of us going to have our full medical history online, available, to hackers or whoever, or not? And if the problem can't be solved, does it mean we go back to old-fashioned paper records, because that's the only way to do things? And so facing privacy, especially when we talk about advanced machines, possibly caregiving robots or cyborgs or computer-based systems that help physicians, are all going to have this information that's potentially threatens our privacy. So another issue, the idea of therapy versus enhancement. So this is, as we look forward to what might happen in medicine. Currently, whenever you've got an identifiable disease or problem that most normally functioning people don't have, we would say that we want to try to restore you to normal function, which we would call therapy. Trying to get you better. Now, whenever you've got a therapy that's trying to restore you from this state of lacking something to normal functioning, the question is always there, and what if we give this to somebody who doesn't actually have a problem? We then enter this realm of enhancement. So it's the border between therapy and enhancement isn't always clear. If I take something to improve my mood, is it some sort of therapy that takes me from the doldrums of regular human existence to regular, or is enhancing my mood so that I'm happy all the time some type of enhancement? And if so, is that a problem? So one can imagine a future where a lot more therapies are developed, a lot of diseases are curable and don't necessarily become a long-term problem. And then the question of, well, what is going to happen if people are saying, well, can you make me a little bit better? Can you make me a little bit smarter, happier, stronger, more resilient? Is there anything wrong with that? And so you can imagine there will be all sorts of questions. And it gets to the heart of what will the role of medicine be? Are we going to reach a technological advance where literally we can cure all of your diseases? Will that happen in 20 years, in your guys' lifetime? Or will it happen in 200 or 2,000 years? It's kind of hard to predict. So we'll deal with some of those issues more specifically in future lectures. But then there's this other thing to contemplate, which is as the idea you've been introduced to, which is, where is artificial intelligence going? Just how intelligent might it get? And when you really think about the exponential growth of computing power over the last 20 or 30 years, it isn't unreasonable to extrapolate that line to think that, the computers aren't just going to become human-like, and as good as our brains. It's conceivable they're going to surpass them and be able to think of things that we never thought of. So there's this possibility that the future of curing disease and fixing human condition is actually going to be done by super intelligent computers that we can't even imagine now. Now, when they call that the singularity, a metaphor that's taken from black holes, that when things in space are all sucked into a black hole, we have no way of knowing what's on the other side or what the inside of that is like. So the singularity, almost by definition, means we don't quite know what's on the other side of that or what it will mean. So I think a lot of what you're going to do in this course is speculate as to what that might be. But it'll be interesting for us to look at, so what sort of ethics will apply conceivably post-singularity if we do have these super intelligent machines and they can cure our diseases, they can do 95% of all of our labor. There's the question of what happens after that that boom of intelligence. So one of the questions might be, will future physicians be human beings, or will they in fact be computers or robots of some type? I don't know if you have any predictions. I think the happy medium that is probably satisfactory to many is that they'll be both. That while there will be excellent computer interveners that will help cure people, they will be working closely with the future physician, not instead of. But again, it's hard to predict. And then slippery slopes. Do you know what I mean by slippery slopes? Slippery slopes are the idea that while we can introduce an idea of something that might be ethically controversial, once it's introduced, we can sort of get used to it, and the moral sensibilities we had that made us exercise caution at first sort of get forgotten. And so as we go through time, we might completely forget that there was any problem or ethical concern with that. So the problem with slippery slopes is that we think we're doing one thing, but eventually it leads to another. So a very common challenge in medical ethics, if you've watched any of the news in Canada in the last couple of years, you know that we now have medical assistance in dying. So people who feel that they're approaching the end of their life, they have a disease that might lead to their death, can potentially avoid some of that suffering by asking somebody to relieve them of their life before the natural end. So some people, some of the opponents of that, would call that a slippery slope, and that while that starts with the idea of people that are really close to dying anyway, they worry that over time it can change our sensibilities so that we think it's, totally okay for people of a certain age to go through that. And so you see certain science fiction dystopia, of the future where, people hit a certain age. I know that there's a famous movie, I think it's Logan's Run. There's Blade Runner, where, is it 30? Age 30 at Blade Runner? Anyway, you can see how the sensibility that the minute we start setting the dates for people's death, that over time that can expand. So that's the slippery slope. So as we're thinking about ethics of the future, we don't only have to think about the thing we're thinking about, but where might that lead over time. So that's what we're talking about. So back to some basic ethics. So ethics and ethics, clinical just means ethics applied to situations in the clinic where you've got patients or doctors or people being healed in the system. So it's thinking about what is right. And right is, when I say right, I mean scientifically valid, useful treatments. So there's a lot of times when we can identify what's wrong with you. Say you've got too many of this cell in your blood, and we know that we've got to get rid of them. And we can say that with 99% certainty, and we can say that our diagnosis and our treatment recommendation are correct. They're right, based in evidence. There are all sorts of other things that might happen where we're not quite sure what's going on with your body, nor are we sure about what the treatment is. And so we can't really with confidence say that this treatment is right or this diagnosis is right. So amidst that uncertainty, which is everywhere in the medical world, we often don't quite know what's wrong with you or what's making you feel this way. We can always attempt to be good, feeling compassion towards the other person, helping them through the radical uncertainty and the potential illness. And so I think the ethical question, we often think about trying to get to the right answer. But the main point here is we very often cannot tell with confidence what the right answer is. So sometimes we just have to aim for good. Sometimes good is good enough. And we shouldn't necessarily deceive ourselves that we know the right answer when there are really tough questions. So the thing about being an ethicist is in the clinical setting, they tend to sometimes ask us questions about things where there is clearly no right answer. You just have to attempt to help people steer towards an acceptable, a good answer. So that's to think about in your minds what is the difference between stuff that we know and can call right and other stuff that we don't know and can aim for goodness. Now, whenever you've got a complex situation, which almost by definition ethical challenges are, it's good to imagine what are we doing when we're examining what should we do. We're sort of weighing and balancing. I think that's another useful metaphor to use. To find the right balance between difficult, complex concepts in order to get to a good or right answer. And there are similarly questions about, is it worth talking about this? Are you guys, probably mostly in your, somewhere around the age of 20 plus or minus a few years. Are you still able to learn right and wrong, good or bad? Or are they already, are you already sort of a written book, that, and so there are some people that say that our sense of right and wrong, good and bad all happens when we're young children, that you can tell from a 7 or 8 year old what sort of path they're on. There are others who say, no, of course we as human beings are continually growing and we're certainly capable of learning ethics and ethical reflection and affecting our sense of judgment. So I realize that as a teacher of ethics, I'm a bit biased. I choose to believe that ethics is something that can be learned and therefore taught, and that we benefit by thinking about such things. And so, whether you are going into a clinical career or some other career, hopefully you'll accept that your sense of right and wrong, good and bad, your ethical sensibilities are not yet written in stone. There are things that can evolve as you think about things. And so a lot of, when you think of how do you get good ethical sensibilities, I think in a lot of ways living in the world, paying attention, looking at medical ethics, maybe a little bit about medical history and literature can assist in understanding stuff that's going on in the world. And so the other thing is that all of you have, I am sure, throughout your lives, taken in many, many stories. Stories with happy endings, sad endings. You've therefore got a good sense of how a story ought to go. So I think in many ways, there's nothing particular about the ethics expertise of the so-called ethicist. All of you have ethical sensibilities that you have been working on in some way or other, probably every day over the last 15 years of your life. So the only difference is that the ethicist might have spent a little bit more time thinking about things in a particular way, but that doesn't necessarily lead them to any better sensibilities about what we ought to do. Hopefully it helps us, maybe lead the discussion among larger groups of people about what seems to make sense or not. So the next few slides are, a basic introduction to ethical theory. So how do we think about what's right and wrong, good and bad? How should we? How have we, particularly in the university, in different departments? So I think a good way to start thinking about that is, you've probably heard the old saying, do the ends justify the means? So when you stop and think, well, what does that really refer to? The ends are the consequences of any action. What are we trying to achieve? The means are the rules or the laws or the principles or the conventions that we think about in contemplating an action. So different ways of thinking ethically are associated with ends, and different ones are associated with means. So this next line, principle-based decision making, that's when you're thinking of the means. So what are the principles? And the idea of using principles is if we like the principle of maximizing benefit for people, or the principle of minimizing harm for them, or the principle of treating people fairly, meaning people who are in a similar situation we're going to treat similarly and not differently for some unjustifiable reason. Or we're going to respect the integrity and opinions of people and try and do what they say. So if you start your thinking that you're going to try to uphold that principle, it should give you a plan of action. I want to respect their autonomy. Well, I need to listen to what are they saying about this thing? How well do they know? Are they well informed? Are they capable of understanding? And if so, is there some good reason why I shouldn't grant their autonomous wish? Okay, and so one of the reasons might be that I'm worried that their autonomous wish is going to be very harmful to them. So then you've got to consider this other principle of wanting to not harm people, or the principle of justice. Other people in that situation don't get that, so even though they want it, is it still fair? And so the way that you use principles is to sort of put each one on a pedestal, think of what does this principle demand of me in this situation, and presumably in any particular situation, one of the principles will emerge as more important than the others, and that's how you use the method. And those and principles might be, a list of rules, a code of ethics, a list of the law, a list of the standards of practice. Any list of rules can be seen as the means or the principles in this type of thinking. So outcomes-based decision-making is another way of doing ethics. And this is where you don't really think of the rules or the conventions. You think of, well, what is the situation? What is a good outcome to fix this situation? And then logically, how do we get there? So it becomes a logical working your way backwards, identifying what the goal is, and then trying to bridge the gulf between the current situation and the desired situation. And it's somewhat practical. It's looking at things in the real world. And different people have argued through the ages that there are different ways of thinking about what's right and wrong based on that. So have any of you ever heard of the ethical concept of what's good is is trying to maximize the greatest good for the greatest number of people. Okay, and do you recognize what famous terrible word that's associated with? I try to get through these classes without even saying the words. The word's utilitarianism. So it's a little branch of philosophy associated with a couple of British philosophers, Bentham and John Stuart Mill, who in the 1900s in England sort of came up with this idea that if you really want to create a good society, this is how you think about things. And so you get different people grasping different theories of how we get to what is good. You know, some very practical, some very rule. So, you know, the philosopher most associated with identifying the principles and acting according to them is the German Immanuel Kant. So Kantian ethics would be principle-based ethics, and then utilitarian ethics would be maximizing the greatest good. So other ways that, other things you should think about in contemplating ethics, other ways of looking at it are the language of rights, you know, it's sometimes put as human rights, the language of duties. So if you're a professional and you've got a code of ethics, it might make clear what your duties are. Laws, you know, all of us have a general intention to follow the law, but the law is sort of general. There's a lot of times if you're thinking about ethical questions in health or medicine, what should I do? The law isn't going to help you. You know, it's a more specific question than that. So at the same time, we know that the law provides a general outline of at least things that we shouldn't cross, you know, lines that we shouldn't cross. So there's another approach to ethics, which I think, you know, I'd like you to start thinking about, which is called narrative ethics. So narrative ethics is asking the question, what is the relevant story going on here that, if properly identified, is going to help me ask this question? And so the story, I mean, could be, in the case of a patient facing a disease, what is that person's life history? What do we know about how this illness affects their life? And if we do that, we might be able to help them make good decisions about, you know, say whether to take this risky treatment or not. The narrative approach helps us think about, well, who is this? Are they a risk taker, or are they the opposite of a risk taker? You know, what makes sense in the context of the story they seem to be spinning in their life? And the great thing about narrative ethics is that it becomes more personal. It doesn't just treat us all as the same sort of rational being. It attempts to incorporate the fact that some of us are proudly irrational, and the decisions that we would make aren't necessarily logical. So the other type of narrative ethics is understanding larger stories. What are we doing in our society? You know, in this type of democracy, you know, we elect our leaders, we like to go and buy things at malls, we have, you know, hard to explain love for small black pieces of rubber going along ice, you know, at least in this part of the world. But asking the question, what is this society's story? You know, so when you look at that question that was brought up, is it okay to do experiments on prisoners? You can understand that how, depending on the societal narrative going on, you might answer that question differently. In this part of the world where we absolutely think each and every individual, you know, should not be exploited or taken advantage of, you know, we would be appalled at the idea that we're going to force any prisoners to participate. There might be other parts of the world where there's more of a collective idea, where the idea that the greater good for the greater number is okay. And some in those places might see prisoners a little bit differently. You know, they don't necessarily appreciate the individuality of each prisoner, but the idea that we're all part of a community, and that the greater good means something. So many of us in the so-called Western world find that idea difficult to swallow. We're very wedded to this idea of consent, and that each individual should get to say no. We certainly shouldn't force people to do things. So understanding the story is important, and as we look to future, applying some of these concepts to the problems of futuristic medicine, we need to imagine, well, what are those problems going to be? Is our ethics the same, regardless of the state of our technology? So just the next slide, the middle path and compromise. In the end, a lot of tough ethical issues, you never get definitively to one side or the other. You ended up, well, on the one hand this, on the other hand that, and the right answer is to try to carve out some compromise between those things. So we're very often seeking what we would call the middle path, or the mean. And so in the history of philosophy, there's a lot of people who have spoken about the middle path, including Aristotle, the Buddha. There's a lot of theories out there about the nobility of finding that compromise between all of the things that affect us in life. And then that last slide, wide reflective equilibrium, that's just the state of having considered a tough issue and coming to some tentative understanding that all things considered, this is what I think we should do, or this is what I think is going on. So equilibrium is the state of being that you're looking for when you're entertaining thoughts about a tough ethical issue. So the next few slides, I think I largely described just in the general overview. But here are some of the fundamental principles of biomedical ethics. So it's probably useful to help, or for you to just keep your mind on these ones. These were articulated in America in the 1970s originally and have withstood the test of time to some degree as the so-called principles of biomedical ethics. So they're often invoked in hospital settings, in clinical settings, and in health research settings. So they are respect for persons, for the autonomy of, so autonomy means somebody who is able to rule themselves, who's able to make decisions, and finding the right ways to find out what does any particular person want who's going to be affected by what we decide. And then similar to that is the concept of dignity. What really does it mean for people to have this type of inner worth, and is it relevant? It's a question that's out there. Beneficence and non-maleficence, again, words you don't need to know how to say as much as mastering the concept. The idea of harms and benefits and getting the right balance, wanting to maximize benefits, wanting to minimize harms, and to make decisions accordingly. And then justice is, it's a concept that's related to the equilibrium. The scales of justice are another metaphor. We want things to be balanced in the end, and we feel better when they are. And so seeking justice, or the proverbial scales being balanced, is another key principle. And so we can ask about each one. What does the principle demand? What is the question? And like I described, when principles conflict, it's very often the case that as you look at how it applies to this particular situation, one of them will become more important than the other. So this is just a slide describing outcomes-based reasoning, consequences. And then the question, in order to get to the goal that we've identified, do we need to violate any principles? So if I come to the hospital and I bring my kid to the hospital and I'm told, oh, sorry, we're full, there's no beds. I could, if I were an outcomes-based thinker, there's a few things I could do. I could go buy some more beds. I could go murder a few patients. Either way, I would fix the problem of there being no beds for my kid. So that would achieve the outcome, but the means would be suspect. Okay, so in a good situation, I recommend considering both outcomes and rules. Because sometimes when you think of people who are in fact psychopaths, it can be the inability to appreciate consequences or things like that. And this slide is just a description of what I said about narrative ethics. In order to know what the patient values or the person or research subject values, we need to know about their story. And then it's worth asking in the clinical setting, who's supposed to know that? Doctors, nurses, researchers, whatnot. And then there's these little things called religion and culture that affect our ethical sensibilities to some degree. You know, I think in some ways they're part of the story that we're weaving. You know, if it's the story of an individual person, are they, were they raised or are they immersed in a particular culture from the world, a particular religion? If so, has that affected their worldview? If it's absolutely central to them, if people feel very strongly about their religion or culture, you know, it's something that we in a health system ought to be able to consider in our own weighing and balancing. This slide just portrays some of the problems that we end up with in health ethics, some of the weighing and balancing that we are led to in the real world. So these are, chance of benefit versus chance of harm. So a typical situation might be, a patient has had cancer, they're 60 years old, and they've just gone to the doctor and have told that the cancer has come back for the 4th time, and it's now, it's in a couple different locations in their body, and they can decide to treat it aggressively or to not treat it. And they know that one treatment is going to be very rough. It has a 30% chance of getting them through it and then going on and carrying on with their life. But they know they're going to be uncomfortable and it's not likely to work. So you've got to figure out, well, what is benefit and what is harm? Who gets to decide in a tough situation like that? And so you can see how it isn't clear what is benefit and what is harm. And so if you're a physician or a nurse or a patient, it might look different. And to get to the right answer, you've got to look at them through the eyes of each person. In medical ethics, the idea of patient liberty versus patient safety is a very common problem. So if you are getting old and a bit shaky and maybe a bit confused, we know that falling is a danger to you. We also know that if you're an elderly person who falls and breaks a bone, it's actually very serious. Very high correlation between breaking your hip, for example, and the end of your life, if that happens when you're an elderly person. So the idea of, well, we could keep all patients safe if we absolutely prevent them from falling, but how are you going to do that? Are you going to tie them down, prevent them from getting up? And what harms would that cause? So there's a lot of people out there who maybe their parent is getting demented when they're wandering around the neighborhood and just about got hit by a car, and they think, oh my God, I've got to go put dad in the locked unit so that he doesn't get lost wandering. Well, that would certainly or potentially make him safer, but at the expense of his liberty. So there are a lot of situations in medical care, especially in people with cognitive deficits, where we've got to figure out what's more important. And if we err on the side of liberty, it means we have to accept that there are some safety concerns, and that nobody can be kept completely safe. And furthermore, if we try to keep you too safe, we really might ruin the time that you have. I know that I personally, if I were tied to a chair, I suspect I would experience sort of claustrophobic panic many times in a day. And I think that I'd probably be better off with the risk of falling. So just an example of how finding the middle path is a challenge. Obeying strict rules versus human compassion. You know, if we have a lot of rules about stuff, you know, when you've got a tough ethical problem, it's usually, or it's often, well, somebody's stretching or breaking the rules. You know, is that okay or is it not okay? You know, and that's where you have to look at, well, what are the rules? What are the outcomes? What's going to happen if you try to intervene? And is that going to create an even worse situation? You know, so an example might be, you know, maybe your kidneys are failing and you want to be on the list for kidney transplant. You know, they've got all of these rules, you know, including the idea that you're not allowed to drink for 6 months because they want you to be able to prove that you're able to be abstinent. So after your transplant, well, let's say it's a liver transplant, that you're not going to abuse it and just. So, you know, maybe it came out that over the last 6 months you haven't had a drink except for that one day on your birthday where you forgot and somebody handed you a glass of wine and you took it down. So if you say that, should that disqualify you from being on the liver transplant list? Or is breaking the rule one time okay? So again, it's an example of how one of the ethical questions is how do we manage this? Is it okay to make exceptions, and if so, under what circumstances? So a few other things. Ethical questions are not just addressed in philosophy departments or medical schools or nursing classes. They happen all over the university. So one of the great things about ethics is that I think it's a true interdisciplinary pursuit. So in philosophy, we sort of look at, well, how do we know what we know? You know, why be good? What is right? What is wrong? How should people behave? All of those questions might come up in philosophy departments. But it isn't, you know, it's far from the only way or the only place that we consider these things. So theology and religion, you know, we know that those have their places in the university. Do you guys know the difference between theology and religion? So the difference would be if you're studying theology, you're studying religion from within that discipline. So if you are a member of the Anglican Church, you want to go study how Anglicans tend to think about God, you would go to a school of theology and study that, with the assumption that you're a bit of a committed Anglican. A religion department in the university would presume that you're studying it somewhat objectively, that you're not necessarily a believer. And so that's the main difference. So we can study religion as a concept, or we can study theology as this idea of revealed wisdom that's come down to us through the ages. So other areas that are really key in thinking about all of this are departments of history and politics. You know, I think in the current age, it's pretty hard to escape the political flavor of the news every day that we see. You know, it just has to do with some of the politicians that are in power. And you can understand how our sense of what's good or bad, right or wrong, permitted or prohibited, can depend on political currents that are happening. So, you know, I think that one can learn a lot about what we should or shouldn't do in the future by thinking about some of these things that are going on in other departments. You know, what can we learn from history? I'm sure you guys have heard the old saying, "He who forgets history is doomed to repeat it." Yeah, that's attributed to the philosopher Santayana from the 20th century. But basically just a general warning, learn from history or else you're going to see it just going in cycles and in a frustrating sort of way. So the social sciences, so those are things like departments of psychology, studying individual personalities and how they develop, sociology, studying cultures and how do people in community behave with each other, anthropology, how do people historically live and what can we learn about human behavior. And so all of those can tell us a fair bit about the human condition. I know that I always, in ethics of medicine, have to consider some of the key learning that I think came out of social sciences, which are about the stages of grief. Very often people in the medical setting are having to make decisions about people who may be sick or dying. And they can affect how you feel. So what's the first stage of grief? It ain't a river in Africa. Yeah, denial. And it's it's an example of how humans really live. So this was put forth by Kubler-Ross, I think, early 70s, late 60s. But she said that when people experience a traumatic event, or the death of a loved one or the illness of a loved one, they tend to experience first denial. I can't believe this is happening. Then they get anger. Who made this happen? Then they go to this thing called bargaining. Change this and I'll be a better person. You bargain with, either if you're religious, with a God figure or else just the general fates. Then depression, oh my God, this is really happening. And then the end of the journey, acceptance. Okay, and we know, I think that when you're trying to figure out, well, what's good and what's bad in science, understanding when people are potentially grieving, if it has to do with illness or death, can really affect decision making. So it's an example of how the social sciences are good to do some reading in. So there's law and the professions. So law, we've got schools of law which look at how people have attempted to codify the general rules of society, which are intended to be dynamic, to change as society's needs change, at least to some degree. The professions are schools of medicine and schools of nursing and physiotherapy and occupational therapy, and dentistry, and all of the different clinicians. And so each of those has their own type of ethic. And then multidisciplinary pursuits. So a lot of knowledge or guidance about how this is going to work comes from different methods around the university. So just when you think about interdisciplinarity, ethics and health ethics are key to that. So just some key concepts to consider. I think we've already done it to some degree, but justice, what is it? How do we achieve it? How important is it? What does it look like through different lenses, in the past, present, and future? Authenticity, I'll speak more about that in one of the upcoming lectures, but that is, what does it mean for two people to interact in an authentic way? The idea of being true to oneself and true to others. And so this question comes up when we look at the future of caregiving. I invite you to start thinking about the question, can you have a really authentic relationship with a non-human entity? Particularly an artificially intelligent being. Can we imagine what that's like? And is it in fact imaginable that we in the future could have relationships with non-human species that are as rich and authentic as the relationships that we seem to seek out with other people. You know, when you look at, well, what are some of the fundamentals of human existence? You could argue that we seek to, you know, to not be utterly alone, to somehow bond with other people, whether they become family or friends, you know, to exchange love in some way between them. And so the question arises, are we ever going to, will that always remain the main objective of human life, which is to bond with other people in some way that makes you feel more whole? Natural law is another concept of, you know, as we try to imagine what to do with this high technology, to see, well, what are we human beings? How malleable are we? If we accept that we've sort of evolved over the last million years, you know, into from some type of general mammal into this, what we are today, is that the way things have to be? And is there some natural law that ought to guide things, or not? And then specifically, there's a lot of people who have written about the natural law, often from a semi-religious viewpoint, but their main point is to say that religion isn't all about magic and divine beings. Sometimes you can look at nature and say it seems to give us a sense of how things are. And then just again, the concept of dignity, and is that something that's really important to people, or just something that we imagine is important? So just some of the things that we'll look for, you know, to discuss in future classes would be integrating the lessons of history. How do we do that? What have we learned from, you know, maybe the excesses of the 20th century? Is there anything we've learned from the past that's going to guide us as to whether it's good to put all of our trust into artificially intelligent beings or not? When we look at how far should we go with high technology, you know, and the possibility that artificial intelligence will somehow become a competitor with human beings. And so I'm sure that last week you spoke a little bit about what might our relationship be with the future artificial intelligence. You know, are we going to enslave it, you know, meaning that it will be just there for human use? Or, as some enlightened thinkers have suggested, if it's true artificial intelligence, we need to think about being in relationship with it, not mastering it and enslaving it. But then when people try to imagine, well, what could go wrong? You know, what could go wrong if we let artificial intelligence grow on its own? Well, does anything come to mind for you? Yeah?
We may lose a purpose. Is like if we have nothing to do, we have no purpose. Why do we even exist?
Yes. So, what will be our purpose in life? So there are many things that can prompt that question. You know, including if there are robots doing all of our labor, how are we going to fill our day? You know, and the answer to that question is related to, well, what is the meaning of human life on Earth anyway? You know, why are we all here? And in order to somehow intelligently answer that question, you've got to have at least some concept of it. So one of the questions that goes on when we think about high technology and advanced technology is, you know, where to from there? You know, what do we do when human beings no longer have to work, and things like that. Is this microphone on? I forgot to turn it. I forgot to turn it on.
It is.
So, you know, just a couple other concepts to start thinking about. And again, this is introductory. Absolutism and universalism. So these I identify as problematic concepts. Absolutism is the idea that right or wrong are there. You know, that there's a way the world is and the way the world isn't. And there are some ideologies around the world that insist that everybody has to believe that way. So absolutism is the idea that there's only one right idea. And universalism is the idea that everybody should follow it. So I know whenever I think about that, imagining the world where everybody is just one way, I see that much more as more dystopian than utopian. And so it becomes one of the challenges. Are we going to identify the way of being in the world and insist on it? Or is it more enlightened to accept diversity and that people around the world are going to be different, and therefore those who insist that their idea is absolute and universal are in some ways going to be in conflict with the rest of the world that respects diversity and different paths. And that, in the end, we need to move towards a sensible provisional pluralism, which I guess betrays how I feel about the previous question, which is that whenever I think of ideologies in the world that imagine this future where everybody has, as they say, seen the light or become all the same, whether that's the same religion, the same language, the same culture, any way I look at that, I see that as a substantial loss for humanity. So maybe I'm just too affected by the times, thinking that diversity is good. It's great how people speak different languages and think different thoughts and come from different cultures. And it's very hard for me to imagine the world being a better place where everybody was the same. And so a lot of this, I think, when we imagine the future of medicine and the future of technology, the world of science fiction gives us this, example of how things might be. And so while I think it's something that we need to deal with in looking towards the future, are the things that we tend to value, diversity and different ways of being human. Is that really the way it should be? Because I know that there are still billions of humans out there who are under the umbrella of universalistic, absolutistic ideologies that kind of think that in the end, everyone will be the same. So these are all things to consider. This is the last slide. I think, I asked you earlier to consider, are there any other issues when you look to medicine in the future that you think will be ethical issues? So I described slippery slopes, the idea that it's hard to know where these things will lead. Accounting for unforeseeable consequences. So when we look at the consequentialist calculation of where are we going, should we let artificial intelligence be free to develop on its own? Are there unforeseeable consequences that we have to weigh into that calculation? Such as the possibility that the artificially intelligent would indeed see humanity as a competitor, and you enter into one of those dystopian science fiction things like The Terminator or The Matrix, where the computers have taken over. The evolving status of eternal questions. So by eternal questions, I mean the questions of ethics. Who are we? What are we here on earth to do? Is there a purpose? Is there no purpose? Are we just one of billions and billions of races? Are we unique? And how does our advancing technologies change these eternal questions? No easy answer to that, but some people would argue that ethics, whatever your technology, in the end it's a similar set of rules and things to apply. I think when it comes to the future, we need to talk about things like patience, progress, and prediction. So even if we sit and predict that because of artificial intelligence, we can presume or hope that all of human disease will be eliminated in 20 or 30 years. And we can then entertain the possibilities of enhancement or life extension. But when you start thinking about life extension, even if we were to just go from our measly 80 years, say, to 120 or 150 years, it raises all these other questions. So, what happens to people? What happens to families? Do you still get married in the same way? If you're going to use technology to live to 200, does your adolescence last for 40 years? Or are all the other time frames the same? And then as we move into the future, I'm sure you've heard a little bit about the predictions and saying, whether it's 2029 or 2045, or when is this all going to happen? When might the singularity emerge? When will artificial intelligence have this sudden flowering where many of our problems are solved? Those are hard questions, but the question of what then is always there. So the elimination of labor, in human beings, as well as the elimination of all want, because we're able to grow all the food we want. You're able to press a button. You don't have a microwave in your home. You have a food processor. You type in what you want, and it produces that. So you can imagine a world where technology has solved our material needs. Doesn't require us to have money or to go to work, but the question is still there. So what do we human beings do all day at that point? And is it fundamentally different? I think that I struggle to think that it will be fundamentally different. In a lot of ways, everything else we do in our lives serves in some way the pursuit of our desire to be, bonded or tied in some way to other people. So even if you don't need money or you don't need to work, so what is it that you're going to do all day? It can't be just pure happiness that everybody's going to walk around in a sort of bliss, although that is one of the things to think about. When you look at possible utopias, maybe all of us, we don't need to walk around with all, the nervousness and sadness that characterize human existence. But we're well warned about that, in Brave New World by Aldous Huxley, where everybody is on this sort of happy pill. You recognize that if you're taking a happy pill and you're happy every day, that on some level you're going to understand that that happiness is not as deep or as rich as the happiness you experience when the possibility of sadness is ever present. And so I would say the same way that however we imagine the technological future, you can't change the reality of sadness. That assuming that, say, people are going to have desire for other people, either as friends or as romantic partners. So the reality of that means that there will be heartbreak in the future, almost by definition, which means that there will be people walking around in states of want, in states of sadness. There's no way to eliminate that from what we understand the human condition to be. So as we go forward, and I really appreciate the way Dr. Soles brings to your attention what many people in the world are saying we should be preparing for, and it might not be 100 years, it might just be 10 or 20. But I say whether it's 10 or whether it's 100, we should have a bit of patience as we go forward, because there will always be that question of what then, and the reason I talk about the rest of the university and all the ways we can approach this question is because to answer that, we really need to think about human life in all of its different manifestations. What really matters? Our society, our individual existence, our political systems, and how are they going to contribute to the future? A few things we know, it's hard to predict, but that shouldn't stop us from trying. So as we, in a course like this, hopefully we can consider what might be reasonable, provisional, cross-cultural grand narratives that will lay the foundation for the future. Is that a narrative of diverse human beings? Language is a main thing. We've got, 10, 20, 30,000 languages in the world. We know that each one has its own way of thinking, and it's probably worth preserving. Is it a better world if we all spoke one language? Or is it somehow not? Pluralism, diversity, and what is good. These are the things that I'd like you to consider as you go through the material in the course. So in upcoming discussions, we'll talk more specifically about some of these things. We'll have a specific discussion about therapy versus enhancement. What is the difference between fixing disease and making people better? We'll have a discussion about robot caregivers, and can they or can they not replace human beings in caring for people who need help? And then we'll have a discussion of, well, what are we to make of this thing called the singularity? And based on how we can best imagine it, how should we think of ethics? Is ethics the same post-singularity as pre? Or can we not even begin to think about it because the singularity is in fact this black hole? We can't even imagine what's on the other side of it. So any questions or thoughts?
So this coming Thursday, there are two visitors to the class. One is a robotic visitor. His name is Boris. He's a Sony Ibo robotic dog. And then one of the students from last term is coming. She'll briefly give you her, she can say whatever she wants. I'm not sure what she's going to say. She'll be here anyway. And a week from today, I think Lakini Bat, who does the videography on Tuesday, is going to talk to you about plans for Future Day. So she's in charge of the student group for this course and would like to get an idea of what she would like to do on March 1st. So we're fortunate that Future Day actually falls on a regular class day this year.
I have copies of the handout that was
right,
sent.
and I've sent it to you, and I was wrong when I said there were 10 registered students. There are only 8 registered students, and you're it. There are 8 people in the room. You are the registered students. So you are it. Yeah. That's the deal.
Right, so for our future sessions, I'll circulate, there's a couple articles I'll want you to look at beforehand, just about therapy versus enhancement and robot caregivers.